Good afternoon, everyone. Thank you so much for being here. We're in our final webinar of our webinar series, and we will be getting started in just about a minute as everyone comes in and gets adjusted. Thank you so much for being here. Excited to have you all for this lunchtime webinar. If you want to pull up the data book in the meantime, feel free. We'll be going through the early care and education in this webinar, so you can have it at the ready for what we're talking about, and we'll get started shortly. All right, in the interest of time, we see we have a critical mass. We'll get started. So good afternoon, everyone, and thank you for joining us for the final part of our transformative webinar series, From Data to Action, Shaping an Equitable Future, based on CCC's 2024 Keeping Track of New York City's Children's Data Book, which you'll find in the chat. Our Hallmark Data Book publication has provided detailed, community-specific data to better understand the status and experiences of New York City's children, families, and communities, and inform calls to action to combat disparities and improve overall well-being. The 2024 edition draws inspiration from the New York City Charter and its new preamble born out of the work of the Racial Justice Commission and approved by New York City voters, with an eye towards building a diverse, inclusive, and equitable city that measures up to the ideals of New Yorkers. To better understand this data, we built out this series to focus on different issue areas one at a time by doing a deep dive on issues impacting children and families. Today, we'll dive into early care and education with a focus on the publicly funded early care system and barriers to access, childcare costs, and budget and legislative priorities to expand care for all New York City children. We have several staff members with us today who will provide insight on these important issues. And following this presentation, we will also have time for a Q&A. So feel free to either put your questions in the chat, use the Q&A feature, or write them down on paper and them when we get to the Q&A. Now I'm going to ask our staff members to introduce themselves, and we'll get started with the presentation. So Rimsha, I will pass it to you.
Thanks, Caitlin. Hi, everyone. Happy Friday. I'm Rimsha Khan, Senior Research Specialist for Data Systems at CCC. I lead the production on key CCC data resources, and I also work on analytics related to population stats, economic security, and housing.
Great. Jenny?
Hi, good afternoon, everyone. I am Jenny Velos. I'm a Policy and Advocacy Associate with a focus on child health and development that includes early care and education.
Wonderful. Alice?
Afternoon, everyone. My name is Alice Buffkin. I am the Associate Executive Director of Policy and Advocacy at CCC. I head up our policy team, and I have a particular focus on areas including behavioral health, early intervention, and early care and education. And I will hand it over to Maria.
Hi, everyone. My name is Drobnjak Marija. I'm on a CCC's data team. I'm primarily focusing on early care and education data, but also other topics that pertain to young child development and protective factors for families as a whole. And I will have a pleasure to getting us started with the presentation. So we can dive in. And as Caitlin mentioned, we will walk you through several aspects of early care and education work that we are doing at CCC. It's my pleasure to be here and have you with us today. It's such a critical core policy area for CCC, as well as a core and essential service for many New York City's families and young children. So we will start with the data trends in early care and education, primarily focusing on public EC programs and childcare affordability. We also work with EC providers and we engage with parents while share some findings from that body of work. And we will end the presentations with policy and advocacy, both on a city and state level, and also the ways that you can engage with us and take action. So to dive deeper into publicly funded early care education program, we can go to the next slide. So a publicly funded EC program is very complex, as you can see on this slide. There is a lot over there, but it really is comprised of contracted programs that had around 113,000 children under 5 enrolled in the last school year. And you probably all have heard of pre-K for all, 3K for all. Both of these programs are universal, free for everyone, and they're part of that contracted subset of publicly funded programs. There is also a smaller share of infant toddler seats and also extended day seats that are means tested, but they're part of the contracted system. And contracted seats are provided in community-based centers. They also include contracted Head Starts. Also, they're provided at schools, at the DOE standalone pre-K centers, and also in licensed family settings. And all of these programs are contracted with New York City's public schools. On the other side, we had around nearly 30,000 children under 5 using vouchers in non-contracted private programs. That is the data as of February 23. And in addition to children under 5, vouchers are also used for school-age children for after-school care. And I will talk more about that in one of the following slides. Vouchers can be used in centers, licensed family settings, and also in informal care. It is a care provided by family members, neighbors in child's home or their home, but it is different and distinctly different from licensed family settings. And vouchers can be issued by HRA and also Administration for Children's Services. They have different eligibility criteria, and I will talk about those in coming slides. And there is also one part of publicly funded EC programs seats provided in direct Head Start and early Head Start programs, which are grantees that contract directly with the federal Head Start office. And while I'm on this slide, I would like to thank our colleagues at New York City Public Schools and Administration for Children's Services for providing us with the data that allow for these analysis that you will see on the next couple of slides. So on this slide, we're focusing on contracted care. And we know that between 2014 and 2024, New York City has made historic investments in its publicly contracted programs, mainly through the launch of pre-K for all at the beginning of de Blasio administration in 2015. So you can see on the chart, this dark blue line, we see a huge expansion in 2015 with pre-K getting to its peak to close to 68,000 4-year-olds served prior to pandemic in 2020. We also see that 3K for all was launched in 2018. It started very small with about 824 children. It reached around 17,000 children prior to pandemic. We see dip during the pandemic in both age groups. And now there is an increase in 3K, like with close to 40,000 served in 2023 and close to 58,000 served in 2023. And we also see that there is a smaller share of infant toddlers served in a contracted system overall. And then when we move on to vouchers, I mentioned that we have vouchers provided for children under 5, but they're also used for school-age children. They're used in non-contracted settings for all children under 13, and they're really coming back to pre-pandemic levels. In 2023, as you can see on the chart, we had close to 57,000 children used the vouchers across all age groups. In fiscal year 24, which is not on a chart, we had over 71,000 children served. I mentioned already that, like you can see the age breakdown in a pie chart on the right, where over 27,000 of all vouchers were used for school-age children, for after-school care, and we see almost even distribution of vouchers for infants, toddlers, 3-year-olds, and 4-year-olds. And I mentioned it on the first slide, that we can go to the next slide, that we have different types of vouchers. And like on this slide, we see we have mandated vouchers for families on cash assistance. These are HRA vouchers. We see that the gray line are child welfare vouchers, and the light blue are non-mandated low-income vouchers. And in 2023, fiscal year 2023, we had around 16,000 children using those low-income vouchers. And in fiscal year 2024, it was around 32,000, so nearly doubled. And I would like to mention while we're on this slide that in October 23, New York State has increased the income eligibility thresholds for vouchers and also for those mean-tested seats in a contracted system to 85% of the state median income, which is close to 100,000 for families of 4. So it means there are many more families can now apply for the vouchers, and we also know that there have been many improvements in how ACS was processing the vouchers, so wait lists were cleared, so way more families are actually able to get the care by using the vouchers. So that is something also to highlight as a positive trend. And with all of this said, like big expansion in contracted space, more and more vouchers used, we know that when we compare that all children under 5 in a city with number of publicly funded seats, that even in the areas of the city where we have a lot of seats, the needs still persist. So on the map on the right, you can see the darkest blue are community districts that have up to 4 children under 5 per 1 publicly funded seat. So up to 4 children still compete or like have access just to 1 seat. So that really is telling us we need more access. And also we need more access for different age groups. In this bar chart on the left, you can see that of all of infants, only 4% are in publicly funded seats, only 12% of toddlers, and while 88% of toddlers are not in publicly funded seats. We know that infant toddler seats are subject to income means tested, so not all infants and toddlers would be able to apply for the seats that are currently within the publicly funded contracts, but we also know that many more families are now eligible for subsidized care. And also there is another element when we think of the need. I mentioned on the slide, if you go to the next slide, I mentioned on the slide with the contracted care that many of the seats are actually for school day, school year, which means they're following DOE schedule, which means 6.3 hours per day, 180 days per year, leaving the holidays and a summer not covered for families. So we see on this chart increase in capacity within the contracted seats for school day, school year seats. We also see decline in extended day year-round seats, which are actually, these sites are open 8 or 10 hours per day, like matching more or less the family traditional working hours, and they're open 225 or 260 days per year. The decline in this type of seats is really affecting the access for families that will benefit from full day care and that really need the care during the traditional working hours. And we will hear after that, as you know, many families work outside of the traditional hours and their care is even less covered. But with this, I will pause it and pass it on to my colleague, Rimsha Khan, to share more about childcare affordability.
Thanks, Maria. Okay, so to start off, I want to go over 2 different measures that were used to look at childcare costs. The first is affordability, which is measured as the share of families with children who pay less than 7% of their annual income on the estimated cost of childcare. So this threshold for affordability is based on the Department of Health and Human Services benchmark, which is that family co-payments shouldn't exceed 7% of the family's income. And the second measure in this analysis is childcare cost burden. And that refers to the cost of care for one child as a percentage or share of median household income for families with at least one child under 12. So in the chart on the left, you can see the estimated costs broken out by age cohort and setting. These estimates come from the New York State 2022 Childcare Market Rate Survey. The data from this survey are used to reimburse providers, and these estimates are specific to New York City. There are 3 age groups that we looked at: infants and toddlers, so birth to 2 years old, preschool age children, 3 to 5, and school age children, 6 to 12. And that's split by setting, home-based care, and center-based care. And these costs range from over $20,000 per year to nearly 11,000 per year across settings and across ages. And I do want to note the preschool childcare cost estimate refers to any full day childcare option that families need to use if their child doesn't receive publicly funded early care education like pre-K, 3K, or access through vouchers. So these are out-of-pocket costs. And school-age childcare cost estimates refer to before school, after school care, as well as care during vacation time. And while there are some after-school programs, they're not universal, and many in New York City do not have access, especially children in elementary schools. And I'll jump into findings about childcare affordability. Keep in mind the definition is that costs can't be more than 7% of a family's income. Otherwise, it's considered unaffordable. The main takeaway I want to emphasize is that across the board in the city, more than 80% of all families cannot afford care for a young child under 5. Now, digging deeper into affordability, we can look into the breakdown by age, setting, household types. And this chart is looking at the share of families that are technically able to afford care using that definition. So among all families, for children receiving home-based care, only 24% can afford out-of-school care. For school-age children, 19% can afford care for preschool age, and only 15% can afford care for babies. Center-based care, in comparison, has slightly lower rates of affordability for the three groups. And on the right, it's even worse when it comes to single-parent families. All of these affordability rates are less than 10%. For instance, only 3% of single parents can afford center-based care for babies, and only 5% can afford home-based care. So there's a big difference between household types, largely because of the differences in income. Typically, a single-parent household is only going to have one income. So to put this all into perspective, the median income for families with children in 2022 was $77,680. But in order for a family to afford childcare for a baby under 2 without any assistance, the family would need around $232,000 in household income in order for that care to be considered affordable, falling under that 7% benchmark. So speaking of incomes, we can talk about another way to measure financial strain, and that is childcare cost burden, the percentage of income that would go towards childcare based on the market rates. Again, here's a breakdown by household type and age group. These are broken down by married or two-parent households, single-parent households, and all families overall. So reading from the bottom up, for center-based care, only 18% of married or two-couple families can afford childcare for infants and toddlers. Only 13% can afford care for, 13% of income would be taken up for preschool age kids and 12% for out-of-school care. Now, single parents have the highest cost burden or share of their income that would get taken up by childcare. So you can see between 26 to 41% of their income would go towards care, technically, just depending on the age of the child, if they're infant or toddler or school age. And across the city, when it comes to households, between 15 to 23% of incomes, depending on the age of the child, go towards childcare. Now, to put this into context, here is an example, because it can all sound abstract. So here's an example of a two-parent family with 2 children. And this visualization tracks the childcare costs over the course of 6 years. So this is a hypothetical scenario using home-based care setting cost estimates. So in year 1, we have a two-parent family with an infant, and the cost of care is $16,250. It remains the same for year 2. And in year 3, yay, we have baby number 2. but that also means more childcare costs. So baby number one is now 3 years old. So that childcare cost is $14,300 and $16,250 for the new infant. In year 4, ideally, child number one is in pre-K, so they'll only need out of school care, which is over $10,000 per year, and care for the second baby, who is a toddler, and again, that's over $16,000. Now, you can see the childcare costs are rising. In year 5, it would be one school-age child and a 3-year-old in full daycare. And in the last year, in this scenario, in year 6, both would be in school, including a preschooler, and the family would have out-of-school costs that are $10,840 for each. Now, added up together across the span of 6 years, that's almost $137,000 in childcare costs if they're paying out of pocket, assuming access to pre-K and the family uses less expensive home-based care settings. So all of this data, except that last scenario, is in the Keeping Track data book, which is online, where you can download chapters and geographic profiles. We also have our companion data site, Keeping Track Online, where you can see detailed data for different geographies, including going down to the neighborhood level. And I'll turn it back to Maria, who will speak more about barriers to early care access. Maria?
Thank you so much. So there was something I didn't mention in the first section, but you might have heard, you probably have heard in the news, and it's really that many, even though we have a limited number of publicly funded seats with limited capacity, not all of the seats are used. And we do have a lot of children in the city under 5, and we have really a huge affordability crisis, as we just heard. So to really unpack more why seats are not being used, we engaged with parents and providers in a project back in 2022-23, which was published in the report, and you will have the link here. And I want to highlight some of the findings from these sessions because they really are adding more context that the administrative data can tell us. So we conducted around a dozen of listening sessions with parents at the time, and parents really elevated these 4 areas as their main areas of concern. And one was really the access. Access is in terms of having a childcare close to home or close to work, having it like where it's easy to access. Access in terms of transportation was a huge barrier, and also hours offered. As I already highlighted in administrative data, parents were elevating that as well. Cost was really a huge concern that parents brought up, especially following a pandemic that had put a financial strain on many families. Parents expressed the concerns about the cost of care, which we understand why. And also parents were not really aware of subsidized care. So that's really important to note when we think about what are we providing citywide, and are parents aware of those services and able to access them. Third bucket was communication. It was really a desire on parents' side for better communication with providers, more information for parents overall, and more information for parents about how to enroll in EC programs and subsidized care, as that was one of the barriers they really were struggling with. Even like once they know where to apply, just like how to go through the whole process is not easy for parents. And understandably, health and safety was really another big concern that parents brought up at that time, especially because of COVID, and also like just thinking about increased trust in providers and sites as really important factor of having children in care. And to complement these findings from the listening sessions with parents, we also have done, if we go to the next slide, we conducted a citywide survey of parents through SMS. And there are many findings that came out of the survey that really just bolstered the findings from the sessions, but I'm elevating these 3. I mentioned already that many families were not aware of subsidies, or they were not aware of programs where they can apply. So they kind of are seeking advice from family or friends to learn about options. It's really critical to support community outreach to ensure that New Yorkers know about their options. And we also know that that burden cannot be left on providers because they don't have capacity. We also asked in our survey at what age parents feel comfortable leaving their child in more organized care. And they really elevated most of the parents that they would feel comfortable leaving their child in care once child gets to 1 year of age or 2 years of age. And we also kind of saw in the data that gap with number of seats available for children under 3. And the last findings from the survey that I want to elevate is that there is really a greater need for seats in extended day programs and non-traditional hours. Many parents need care throughout the workdays, but also they need care during evenings, overnight, and weekends. And when we think about those, we really think about different industries that are really not happening within the traditional work hours. You have the link for the report here, and it will be also in a chat. And I will close this section with some of the operational concerns that providers have been elevating for the past couple of years. Even though some progress has been made, most of these are really still true. You probably have heard about contract payment delays over the past few years, which really caused instability for many providers, and several had to close their doors because of this, or take a huge loans on their own to be able to sustain and have the programs open. There is also something about contract inflexibility that really is affecting providers' ability to serve families and families' emerging needs. The providers express desire to be able to age down services or mix 3s and 4s, like have more flexibility how they organize their classrooms. Centralized enrollment through the My School portal really is limiting community-based provider visibility, but also their ability to support parents with that application process. Providers need to be able to play an active role in supporting parents through that process and also be able to enroll children on sites. So there is a lot of conversation in that space. And also about cities streamlining multiple online points of entry for application to different programs. As we know, we have vouchers, we have contracts, but then we also have school day and extended day, and each of these is kind of taking you to a different application, through a different application process. The issue of shortage in EC workforce and high teacher turnover has been present for the past couple of years because of salary disparity between how much a teacher paid in CBO centers versus school. And even though we had a major win in 2019, it has not been achieved for all staff, nor it applied for like the longevity. And there is also disparity in health benefits. So that is like ongoing. We have this kind of competition between two different sites, and teachers really having more incentives to be hired by the DOE. Also, I mentioned that providers don't have capacity to fund the outreach, and city is really lacking and needs to do more in providing culturally appropriate community engagement so families can really know what their options are. It has been done in a really great way when pre-K was first launched, and many families were really aware of the program and they were using it. And providers also on their end elevated that school day, school year seats tend to be not used, but while they have wait lists for full day programs. And additionally, this model is causing also their fiscal instability because this is not covering teachers during the summer months and like during the full day, while they need to maintain and have a teachers on staff throughout the whole year in order to be stable. So you will hear more about these concerns and many other ways in our policy and advocacy section. So I'll pass it on to my colleague, Alice Bufkin.
Thank you, Maria. So I am going to kick off our discussion around EC policy considerations at the city and the state level. And before I do, I just want to kind of take a step back and underscore the urgency of New York moving towards universal access to childcare. You know, this is not a niche issue. There are 1.1 million children under age 5 in New York State. They have families who need safe and affordable options for care during the day. And our city and state's failures on this front are really having massive impacts on the lives of New Yorkers. At the foundation, families are suffering due to the extreme economic burden of childcare costs, which Rimsha spoke to. Families can pay up to 63% of their annual income on these services, and the economic burdens are disproportionately harming women and especially women of color. And it's not as if these high costs are being, given to the workforce. The workforce is also deeply underpaid, which has led to a real capacity crisis. In fact, New York's early childhood educators, who are, again, overwhelmingly women and women of color, live in poverty at nearly twice the rate of New York workers in general. And at least 65% of the childcare workforce is receiving some kind of public benefit. And we can see the collective impact of this on New York's economy, which saw a loss of $23 billion in economic activity as a result of a lack of access to childcare. And finally, we're denying children high quality comprehensive care they need to thrive. It's also important to know the reality that, New York City has been and can continue to be a leader in expanding childcare and early education options to families. We've been a leader nationally. We just need to make sure we have the political will and the commitment to expand access and address system barriers, many of which Maria and Rimsha have spoken to. So with that framing, I want to orient us in today's EC landscape and start by looking at the situation that was facing us at the beginning of this year. It truly was a perfect storm of threats to the city's ECE system. At its base, we knew that in the preliminary budget that the mayor proposed in January, there's $170 million in cuts to the 3K and pre-K system. This was on top of other cuts that had been proposed and implemented in 2022. And the primary justification for these cuts was that the city had a large number of open seats. But as Maria and Rimsha have so clearly laid out, there is no lack of need in the city. In fact, the opposite. Look at the data, talk to parents, they're clamoring for affordable options that fit their needs. Instead, our city has just never adequately tackled the array of barriers that are preventing access. In addition, we saw the city facing an enormous threat because over $600 million in federal COVID-19 relief funding was about to expire, specifically for education programs. So this funding covered a wide array of critical education services and programs, including significant funding for 3K and preschool special education. On top of that, we were facing the expiration of funding for Promise NYC, which is an essential program that provides childcare access to undocumented families. And then overall, we had sort of these looming operational challenges impeding access overall to ECE. So in the face of these threats, we saw a really remarkable coming together of advocates to push for what was needed in the ECE system. CCC did much of our work in partnership with the Campaign for Children, or C4C. It's a coalition of providers, parents, and advocates that's fought for years for universal access to youth services and early care and education. We also saw the formation of United for Childcare, which is a new group mobilizing parents around universal access. And we saw the formation of the Emergency Coalition to Save Education Programs, which was a collaborative of advocates across the city fighting to ensure that New York would continue to fund those array of programs that were at risk of entirely disappearing as a result of the loss of that $600 million in federal COVID relief funding. And in addition, numerous council members, the speaker, were instrumental partners in fighting for restorations. And in the end, we did see urgently needed restorations and investments, which is a real testament to this advocacy. Those investments included $20 million restored to support additional ECE seats. We saw $25 million to add to extended day expansion. So again, providing more opportunities for longer hours and summer programming for families. We saw $5 million for ECE outreach and education to engage families in the care that they were eligible for, and $30 million to reduce wait lists for preschool special education. And we also saw over $600 million in education programs restored to replace that expiring federal stimulus money. And then promisingly, we also saw a commitment to reoccurring meetings between the council and the mayoral administration to address many of these system challenges that we've spoken about. So, all of this is really critically important, a result of advocacy. And we know that we're still falling short of the depth of the need in the city, and that there's a lot more work we need to do to make sure that every family has access to the care they need. So that brings us to recommendations as we're kind of looking at the path forward at the city level. So first, we need to just protect the funding that was included and only included for 1 year in the most recent budget. So many of you on this call may know this incredibly well, but much of the funding in the city is 1 year funded, which means if you don't fight for it, you have to fight for it every single year or it goes away. What we want to move towards is baselining important programs, which means it's put in the budget in perpetuity. It's there forever until someone tries to take it back out. And so some of these critical areas were $25 million for Promise NYC, which was an increase over the previous year, but is only 1 year funded. Same goes for a significant amount of 3K investments, $55 million for preschool special education classes, and that $5 million in outreach and marketing. So those are important areas to protect and baseline. And then we also can turn to look to access to families. And many of these recommendations are the direct mirror of the issues that Maria is raising that we hear from both providers and parents. So, as families report, there is a widespread lack of knowledge about 3K and other EC services. It can be incredibly complex and overwhelming to apply for them. That $5 million for outreach and education was a really important first step, but we also need to look to the success of things like pre-K, the pre-K program, which had a massive outreach ground game, included robust staffing, multilingual outreach, extensive flyering, engagement in spaces like churches and barbershops. So that's the kind of scale that we need to consider if we want to make 3K and other EC services, known and successful. Also in other areas, the online application process for these services is incredibly complex. It's Byzantine. It's in need of serious reform. So there's a lot of work that can be done to make these really consumer friendly and as easy as possible for families. We also need to address the barriers that make it hard for providers to enroll families and match their needs. So one area, for instance, is in moving away from centralized enrollment. So if you walk to your local childcare provider, you say, I'd love to, put my child in the seat, and they say, great, we have an opening. They can't just enroll you on site. They have to send you back to the centralized process, and you may get, you may end up where you want to go, or you may not. So there's things like that we can improve on. More contract flexibility to providers so they can more closely match the needs of families and their communities as they change. Another area that's important is continuing to convert school year slots to full year slots. Again, having a program that ends at 2 p.m. is not going to work for most working families, much less those with more non-traditional hours. And we know that the need for childcare doesn't end when the summer starts. So we have to continue to build on what have been very successful efforts already to give parents more options. We just need to make sure that they're available for all parents and they're known about and accessible and easy to access. And then finally, the city has been making progress on securing special education seats for students who need them. But we know a lot more seats will be needed as the new year progresses. And in addition, this past year, thousands of preschoolers experienced delays in receiving their services or never received them at all. So it's urgent that the city prioritize both securing seats and providing the full array of services that children need and are entitled to across all EC settings. And the final sort of area I'll speak to is about supporting the EC workforce and ensuring fiscal stability of the system. So, despite obviously really important wins in 2019, incredible advocacy that led to trying to achieve parity, we still see a great disparity between the salaries and benefits of early educators in New York public schools compared to those in CBOs, providing the same level of services, the same credentials. So it is really urgent that every EC provider in a CBO setting receive the compensation they deserve, and that will make the system sustainable. In addition, this is not unique to the EC system, but there are millions and millions of unpaid contracts, work that our EC providers have provided because they're mission driven, but have never been paid for those contracts by the city. Again, the city is making a lot of progress. They're addressing this, but especially if you're a small provider, you can't stay open with that setup. You cannot continue providing services and not be able to bring in the compensation for the great work you're doing. And then finally, we need to increase the state's part in the city's ECE system. Over recent years, we have seen the city take on a much larger share of the EC budget, and the city can't do this alone. We represent about 45% of the child population, but the state funding accounts for only about 24% of New York City's EC budget. And I think that ultimately brings us to our next segment, where we'll talk a little bit about some of the state considerations and policies. So with that, I'm going to hand it over to my colleague, Jenny Veloz.
Thank you, Alice. And as you've heard from Alice, from Rimsha, from Maria, there are huge barriers, challenges to the ECE system in New York City. So what I'm going to talk about is what is happening on the state level. What's going on the state level in regards to childcare and ECE. So first of all, CCC is very proud to be a member of the Empire State Campaign for Childcare, which is a statewide coalition of parents, of childcare educators, and advocates who believe that every family in New York State deserves high quality universal childcare and that every childcare educator deserves to earn a thriving wage. So over the years, the coalition's advocacy efforts have led to significant investments in childcare access. One of those investments is the income eligibility cap to the Child Care Assistance Program was raised from 200% of the federal poverty level to 300% of the federal poverty level. Now, the Child Care Assistance Program helps and provides financial assistance to low-income families and families receiving public assistance to pay for childcare. The program is managed through the Office of Children and Family Services and is administered by local departments of social services in 57 counties and in New York City. So that's a very important expansion and a very important investment because the CCAP promotes early childhood development while allowing parents and caregivers to be able to work, to be able to go to school, or to go to some form of job training. Also, another investment is the reduction of the CCAP copay to no more than 1% of family income above the federal poverty level. So what that means is, for example, a family of four making over $30,000, only 1% of their annual income will go towards copay. And in regards to the expansion or the increase of the income eligibility cap, an example of that is at 200% of the federal poverty level, a family of four would make 55,000 would be eligible. But raising that to 300% makes sure that a family of four who making 99,250 annually would be able to be eligible for the Child Care Assistance Program. And also, there was a small expansion of a statewide pilot program to provide childcare assistance to children ineligible for CCAP because of immigration status or because parents engage in episodic or gig economy, which is pretty much the service economy, individuals who are working, let's say, as food delivery service drivers, or who work, let's say, in the rideshare industry, such as Uber or Lyft, who may not have consistent hours to work or even consistent salaries. This small pilot program helps with their childcare. Now, even though these have been significant investments, there is still a long way to go to achieve that universal care. Now, what are some of the challenges to accessible and affordable care? Because there are many. So families struggle to find childcare programs that meet their needs. As Alice stated, these challenges not only happen in New York City, but are happening across the state. There's capacity issues continue to make it difficult for families to access childcare. For example, we heard about in New York City how there's more demand, there's more need than there are seats. There's more children than there are seats available. And just an example of that on the state level, it's not rare for enrolled counties to have one licensed childcare spot for every 6 or 7 children. And that is a hardship that families are continuing to experience trying to find childcare for their children. And many families cannot afford childcare without some form of assistance. And many of these families can access childcare because they work non-traditional hours or have fluctuating or inconsistent work schedules, whether they're working in the retail or in the service industry, which results in them having to pay more out of pocket for childcare costs. This all leads to that one key reason why capacity isn't matching demand for childcare, and that is the low wages in the childcare sector that is creating that workforce shortage. Childcare workers are earning an average of about $35,000 a year, which is less than 96% of occupations in New York State. And as Alice mentioned, many in the childcare workforce are women and women of color. So these staffing shortages have a huge impact on a childcare provider and program's ability to be able to operate and provide the services needed for these families. This can result in reduced hours of childcare, or it can result in a childcare program closing, which impacts families' access to having consistent childcare. So what can be done? What are we doing? What's happening on the state level to make sure that families are able to access childcare? So first off, as I stated, the Empire State Campaign for Childcare has been very active in prioritizing and helping to cultivate 3 bills that will expand eligibility to childcare for families. The first bill is decoupling bill. So right now, under the Child Care Assistance Program rules, families can only use child care assistance for the exact hours that they work. But this bill would end that rule of tying child care assistance to a parent's exact hours of work, giving parents more flexibility and being able to work consistently. Now, that bill is on the governor's desk. It was sent to the governor yesterday and is awaiting her signature. The second bill is preemptive eligibility, which allows a family quick access to childcare while they're waiting for their application process to be completed. Now, that bill was signed by the governor a couple of days ago. However, it wasn't the bill that many of us would have wanted her to sign. It was instead the bill that was signed, instead of requiring presumptive eligibility statewide, it gives the counties the option to implement it using childcare block grant funds. So even though it was a small victory because she did sign the bill, more work needs to be done to ensure that families are having this access to childcare while their application process is proceeding. And the third bill, which is also on the governor's desk, waiting to be signed and needs to be signed today. She has until today to sign it, is the minimum earnings bill, which eliminates the minimum earnings requirement for CCAP eligibility, where parents and caretakers are ineligible for childcare because they earn too little. And this can include many childcare providers. Many childcare providers, again, as mentioned previously, need assistance, are on some form of assistance or benefit because they themselves cannot afford childcare. So this bill would exclude, currently parents who earn less than the minimum wage are excluded from accessing childcare, and this bill would eliminate that. As I said, that bill's on the governor's desk. She needs to sign it today for it to become law. And many families who are affected, especially by the minimum earnings requirement, again, are those in a gig economy, are those who may not have consistent work hours, and which results in earning too little to be able to access childcare under the Child Care Assistance Program. Now, if this bill were to be signed in New York City alone, it can benefit up to 10,000 families. Now, what are we doing next year in regards to the budget? Again, there are many things that need to be done in order to ensure affordability, accessibility to childcare. One of the main issues around inaccessibility to childcare is workforce. New York State needs to continue to make those substantial investments and those significant investments to high quality childcare. And to do that, childcare workers need to be paid. So one of the priorities of the Empire State Campaign for Childcare is the creation of a workforce compensation, which provides a sustained, reliable compensation and benefits to all members of the childcare workforce. Without these investments, and if we continue to have the workforce shortage that we currently have, children will not be able to receive that early care and education to meet their development needs. Another budget priority that we are going to work on and advocate for is making sure that the Child Care Assistance Program is accessible to low-income New Yorkers, making it a state-funded entitlement for families making less than 250% of the federal poverty level. And a third budget priority is ensuring that eliminating barriers to accessing childcare for children with developmental delays and disabilities. And to do this is increasing the enhanced rate for children with special needs to 130% of the market rate, which would be up from 115%. And also taking the necessary steps to make it easier for childcare programs to receive that enhanced rate. Another priority that we will be working on that advocates are going to continue to fight for is to change the foundation aid formula. As many of you know, foundation aid was created over 15 years ago to make sure that districts had the resources to meet the basic needs of students. Public is a public school formula, making sure that these districts had the resources so that all children had equitable education. However, that formula is very outdated and it hasn't really accounted for growing costs of providing kind of like that high quality education to all students, especially students with disabilities, especially students who are English language learners. students experiencing homelessness, and students who just have or need additional support. So what we want to do is we want to fight and advocate to update that formula, because right now it only covers K through 12. That formula does not cover 3K. So updating the foundation aid formula to reflect the needs of kind of a unified system starting from 3K all the way to grade 12, and ensuring that funding for special education programs and services to students with disabilities continues up until they turn 22. So how can we take action? What can we do to ensure that on the state level, children, families are getting the childcare, are able to access that childcare? One, we need the governor to sign the 2 remaining bills on her desk. So in the link, there is a take action to send a letter to the governor urging her to sign those bills. And there's also an advocacy toolkit that was created through the Empire State Campaign for Childcare that allows you to choose your own take action, allows you to give you the flexibility on how you want to take action and how you want to make sure that the governor is signs the remaining 2 bills to ensure expansion of the childcare system. And also the Empire State Campaign for Childcare is having an advocacy day on January 28th. Registration link is in the chat, in Albany, to speak with elected officials, to let them know the urgency, let them know why this is important, why investments need to be made and need to continue to be made in childcare so that every child benefits from early care and education, that every family no longer needs to struggle to be able to afford childcare costs, and that the needs are met for children across the state. Thank you.
Wow. Thank you so much for that 52 minutes of information. That was so full. I'm so grateful to be learning here with you all. We have 8 minutes left, so we will shift to a quick Q&A. I think I'll start for our policy folks. What should New York City do to prepare for a new presidential administration coming in? I'm going to drop a link in the chat because the city administration has already sort of started a kind of protect our city focus to have conversations around this. So I'm going to drop that link in the chat, which touches on it, but I'll open it up to Alice. I see you come off mute to kick us off.
Sure. I mean, there's an incredible amount of uncertainty, obviously, both about which of the proposals on the campaign trail will become a reality and when. There's the reality that this administration can only do so much at any one time. So the timing of when different things will be enacted or if they will be is challenging. But I think as we're trying to look ahead, I mean, I think in this space, one of the number one concerns and anxieties that folks have is in this proposal that's in Project 2025 to eliminate Head Start. That would obviously be disastrous, unconscionable, and would be disastrous to many of the states that are, have voted most for this administration. So I think that is a piece that tempers it, and a lot of the advocacy will be not only happening here at the state level, but really working with partners across the country in a united front to uplift the importance of programs like Head Start, the extreme repercussions of making an effort to eliminate it. So I'd say this is not just in this area, but across. It is really about recognizing that we're not alone in this, and that there are folks all over the country who are having these same conversations, these same fears, and really about partnering to delay and ultimately prevent many of these proposals. The federal government was already only giving, I'd say New York City was only getting about 23% of its budget. In a different world, we might have been fighting more for more of those fundings to come to the state. Not that we wouldn't keep doing that, but so much less likely. So there's that area of it. I think another place where the city and the state can do important work is in looking at the fears that immigrant communities will have under this administration. So, many recall, obviously, things like the public charge in the previous administration that was really building on deep anxieties and concerns and fears that immigrants had about what using certain benefits, what the impact of that would have on their immigration status. We're likely to see a lot of that again. And so there needs to be a lot of care towards having bilingual services, having community-rooted supports to help families understand what they're eligible for and make them know that it is safe for them to access that. So that's another space where we can look. Those are just a couple of things that come off the top of my head, but if anyone else wants to jump in, feel free.
Thank you, Alice. Yes, I think everything you said was very on brand, and we just have to keep our advocacy going to ensure that we are spending money in ways that uplift families. And Rimsha, I do have a question for you. Also, yes, these are all of our emails. Please feel free to email us any follow-up questions. We will be sending out resources, but I'll follow up that after the Q&A. There was a question about affordability. Is the cost burden for childcare based on a family's net or gross income?
It's based on gross income.
Great.
That's data from the American Communities Survey population estimates.
Amazing. So we also have some comments and questions from Sarah in the chat. Or in the Q&A. And I would say we completely agree that our values as a society feel skewed when you look at a budget. We know that a budget is a moral document. It shows what we think is important and where our money goes. We know that housing is pivotal. We need housing. We need higher quality housing. The profits of landlords over childcare and over quality housing could be its own webinar. And so we definitely are in accordance with you there. And I think part of CCC's work with our research and our data and our advocacy and our civic engagement is how do we create culture shifts? How do we shift how we look at our city and at our society, not as a place where people are just trying to make it day to day, but as a place where people thrive and people are comfortable exploring new things. Like we've seen like so many beautiful things have come out of New York because people dare to take that risk. And we should never allow economic insecurity due to housing or childcare or food or I don't know, youth services or being criminalized, like impact that ability to be creative and create. And so, yes, thank you very much. I'm also seeing like questions keep coming in as we're going, so provide. So Reverend Dr. Calvin Kendrick, many of the decisions will be controlled by the federal government, but the local officials, correct? Also with so many daycare centers under enrolled, why are there so many open seats? Great question. So with Head Start, as Alice mentioned, that's mostly federally funded. So that will have that would be impacted if the Project 2025 goal continues. But at the local level, there is so much power at the local level. And we have a lot of champions in city council. We have a lot of champions in the state assembly and senate. So we have to maintain that hope that we will be able to mobilize and make sure that we have support for families. I think the minimum earnings bill is one that really gets me going because what is the point of having services to support families when you're saying families who do not make enough money do not get those services? That just fundamentally does not make sense. So feel free to call the governor and let her know that you want that bill to be signed. And then regarding the under enrolled and so many seats, anyone feel free to hop in if I missed something. A lot of times we have issues with a lot of the seats that might be open could be school day seats and parents need full day care. And so there's a mismatch of what is existing versus what families need. Also, there could be, I don't know, like some parents want to have their daycare closer to where they work. Other times parents want their daycare closer to home. And so if that doesn't work, that creates a mismatch. I know some families live in Brooklyn and got placed in daycare in like the East Village, and that didn't work for them. And so things got skewed. But I'll pause there because I know our data experts know more, just to make sure I covered everything there.
Yeah, I mean, I think really Maria's sort of research that she walked through earlier really draws, really highlights where we have this gap between access and availability. So all the issues that Caitlin talked about, and then also understanding and knowledge about what's available. Maria, you can, I'm going to forget the figure, but an enormous number of families just reported, I didn't even know that this resource was available to me. So that outreach, that education piece is central. Yes, having hours that match and locations that match the needs of families. There's a lot of concerns around, some families come in and they really want to make sure that they feel very confident about the safety and the quality of the site, and they want to be very familiar with that. And if it's not where they're based, they may not have that comfort and may not take that opportunity. Maria, if you want to jump in, I don't know if there's other pieces of kind of what we've dug into that really draw a highlight on why we see this mismatch.
Yes, what came to mind, and I think I didn't have it on a slide, is also that sometimes we have a competition between the seats. Like sometimes there might be a DOE school or a DOE pre-K center, and there might be a CBO center, and then like we have maybe too many seats in one space to serve the families, and maybe families are gravitating towards school just because how the process is going through the My School portal. So I think that can be one. I think also families also are choosing probably just like something that is more culturally appropriate for them. And if there is not that outreach and level of trust built, that can also affect like where families gravitate. And I think hours of work compared to hours of care is definitely one aspect.
Thank you so much. We
And
are.
I'll say one other plug, just the deep complexity of applying and accessing care and understanding it is just, there's so many things we can unpack there, but that is a huge part of it, whether it's online or,
Yeah.
and I realize we're over 1 o'clock, so I'll stop saying there, but I'd say that looking through the Youngest New Yorkers report is a great place to explore really what's when you actually talk to parents, why is it that it's disjoint?
Yeah, and I will just add to that. Also, we see also that families try to apply for type of seat that really doesn't apply to them without understanding like they need to be under a certain income to apply for extended day seat. And so they might go down that path and then drop out because they're not able to apply for that type of seat. So it's information.
Great. Thank you so much for being such a engaging and questioning audience. We really appreciate everything. All of these questions you brought up were so incredibly great and technical, and thank you for being so engaged. We will be following up with materials from this webinar in the following week, as well as steps to remain involved in our advocacy. We have upcoming advocacy days, advocacy events, product drops, a host of things to keep an eye out for. And so yeah, keep an eye out for them. And we hope you have a wonderful weekend. Stay warm, and thank you again for coming. Really appreciate your time. Take care, everybody.
Thank you.